Good evening, everyone. Welcome to the second DEC meeting. This time we have Dr. Arun and Dr. Bednarski from Aspen Dental. In addition, we have Jeffrey, who is the Senior Manager of Academic Relations from Aspen as well. I'm going to let Dr. Arun and Dr. Bednarski introduce themselves. They're going to tell us about their relation and then how they started working for Aspen and their experience. It's better for it to come from them. But I want to encourage everyone to, this is supposed to be a ask question, like they are here to answer your questions. And please encourage everyone to use the Q&A button to ask anything that you want, especially about like new dentists and the relationship that they have, because Dr. Arun is the mentor and Dr. Bednarski is the mentee, actually. So I'm going to let Jeffrey take from here. And again, please feel free to ask any questions that you have, because this meeting is all about that.
Awesome. Well, thank you, Armin. I really appreciate it, and the entire DEC over at NYU for helping set this up. The goal tonight is to make sure that you all as attendees, get everything you need to know about Aspen Dental and the new dentist experience. As Armin, I'm going to echo what Armin said. Please don't be shy. Use the Q&A button. The content should be driven by you as the guests. Our doctors are fantastic, and they've taken time out of their schedule to come and make sure that you all have all your questions answered. So without further ado, I'm going to go ahead and I'm going to allow Dr. Arun to go ahead and introduce himself first, and then we'll have Dr. Bednarski go as well. Thank you, Armin.
Hey everybody, good evening. My name is Dr. Arun Srinivasan. I graduated DMD in 2006 from BU. I started with Aspen right after finishing school. I started as an associate, and after a month I became a clinical director, and I bought my first practice in Aspen within 11 months of starting in Aspen. And today I got 9 practices that I own, and I have 13 doctors working for me in my team. My practices are from Boston all the way to Providence. And so this whole area between south of Boston and Providence is kind of my region, and that's where my offices are located. Other than that, I served in the US Army for about 9 years, from 2009 to 2018. I'm a former major in the US Army. I was a dentist in the Army. And I have 2 daughters and a dog, Lucky. He just came and said hello to everybody. And yeah, that's a little brief of me. I'm more than happy to answer your questions today and walk you guys through our journey and help you guys understand what we do and how we do.
That's awesome. Great job, Doc. Dr. Bednarski.
Yep, so my name is Justine Bednarski. You all can call me Justine. I'm originally from the Chicagoland area. I got my bachelor's in chemistry at the University of Illinois. I graduated in 2014 and then went to the Ohio State University for dental school. Graduated in 2018 from there. And then I was looking for a change of scenery and somehow ended up looking into the Boston area for work. Before that, I actually was thinking about doing a GPR. So when I was in my 4th year, I didn't really feel that much experience with dental school. And I'm sure with COVID now, you guys are probably going to feel the same way. However, I applied for GPR programs all across the country. I really wanted to go to a good program in a big city. That was something that was really important for me. I interviewed at one program and I found out in late January of my D4 year that I was not going to be in any of the GPR programs that I wanted to go to. So I started thinking of other options. I still really wanted to go to a big city. Chicago just wasn't really where I wanted to go yet. And then I started looking into other options. I actually reached out to Jeff kind of mid-February, freaking out because I was looking for a job, and everyone, in my class seemed like they had it figured out. So I reached out to Jeff. I knew Jeff from ASDA, so that was the student organization that I was most involved with, and I had a good relationship with Aspen and a lot of the reps. I had gone to a lot of events as a student. Everyone, all the practice owners had really great things to say, and all seemed very happy working for Aspen, even though your professors will probably say otherwise sometimes. But corporate dentistry is obviously much different these days too. So anyways, I reached out to Jeff. I told him I wanted to move to Boston. He told me that it was a very saturated market and that I probably would be struggling finding a job out here. But I chatted with one practice owner who unfortunately wasn't hiring, a second that also wasn't hiring, and then Dr. Arun, thank God, took me under his wing and offered me a job about a week before I graduated. I think it was like April 24th, and I graduated on like May 4th. So anyways, I joined Dr. Arun's team July of 2018 as an associate, and then transitioned into being a lead in one of his practices in Dartmouth. It's about an hour south of Boston, and took over that practice in December of 2018, and then got officially promoted May of 2019 to a managing clinical director role that I've been in for about a year and a half now. So
great. Thank you, Dr. Bednarski. Dr. Arun,
Yes.
I want to ask you a quick question. So, yeah, Dr. Bednarski is correct. Like I told her, it was going to be challenging to get into the Boston market. First of all, there's a little nepotism going on with Tufts and BU, right? And there's a lot of dental students, but there's not a lot of turnover in the area. Dr. Arun, what did you see in Justine in your first meetings that made you take a chance on Dr. Bednarski?
Actually, the meeting was over a Zoom call like this. It was a FaceTime call. I didn't even meet her in person.
Wow.
And I think she was in Ohio at the time, and we had a FaceTime call. And I said, "So, Doc, what are you expecting out of me?" And she said, "I want mentorship, and I want to learn from somebody who's doing dentistry at a higher level." And that's what I was looking for. I was looking for somebody who was willing to learn and motivated and energetic, and with an open mind, and not having closed off mindset, as in I want this, I know this, but also actually be, whether I know it or not, I want to learn it from you. And that is what I was looking for, and it kind of clicked for us. And Dr. Bednarski has been fantastic, and she's come to her own level of success that she's in the big leagues now. So I'm very proud of her.
Yeah. I'm proud of her too. I've known her for quite a while, and I knew she was going to be fantastic. So Dr. Bednarski mentioned MCD, you went in a lead dentist, you mentioned it too. So can you talk about the difference between bringing somebody on as an associate and what is expected of them? And then what do you look for somebody to get promoted into a lead dentist in your group practice?
So fresh graduates typically have the base fundamentals of dentistry. They know dentistry, they know the theory, and real world dentistry is a lot different than dental school dentistry. You don't have a professor standing right next to you, so the fear is there, the confidence is lacking. And so for them to come into real world and see patients, and patients also behave a little differently than what they behave in the dental school scenario or setting. They are paying money, and hence their expectation is in a higher level. And so as an associate doctor, they are only required to take care of the procedure that is there in front of them. They don't really have to do much more than what they have to do. And they're only allowed to do stuff, or only given stuff that is comfortable for them. And we don't expect them to do, a full large, roundhouse crown prep or a bridge prep on day one. So we give them the sufficient time that they need, so they develop the confidence and learn from the existing doctor as a clinical director, and see how he operates, and see how he manages the practice, see how he manages his patients and the time that he has. And then when they get comfortable and confident in dentistry, then I make them a clinical director or move them into an office of their own, and I take them under my wing as my mentee directly. So initially they work with a clinical director. That is their first step to ease out of dental school into real world. And then once the clinical dentistry becomes strong and they want to branch off on their own, then I work with them one-on-one. And I think I worked with Justine 4 days a week to begin with, and then 3 days, and then weaned off to 2. And then finally I said, Justine, you can handle this. Call me when you need me. And that's kind of how we progress. And when I step out completely as a mentor from that practice, and Justine took over the practice with me being there 2 days a week, I think we promoted her to be a clinical director. So it was a slow, very processed way of, letting the young doctor come into her own and be successful.
That's fantastic. Great job too. And Dr. Bednarski, I'm sure even as an associate, you had some days that were a little bit overwhelming, right?
Oh yeah.
So
Yeah.
talk to us a little bit about what you do in those days that are you're kind of lost and overwhelmed. What was your process of getting through those days?
Yeah, I mean, there were a couple days where, I mean, there was rarely a time that I was really by myself in the beginning, unless I was covering an office. Kind of, would let the office manager there know that I'm newer. I need more time for my procedures. I don't want to be overrushed. I don't want to be, doing shoddy dentistry, especially as a new grad. I want to stick to the fundamentals and do what I'm comfortable with. But I always had another doctor that I could reach out to when I was stuck in a hard spot. I remember there was one Friday afternoon. It was like, right, I think I was working in August, a month after I got hired, and I got stuck doing like a full mouth extraction and denture. And I couldn't get one of the roots out, and I was freaking out. I was sweating. I called Dr. Arun. I'm like, I don't know what to do. It's Friday. It's like Labor Day weekend. And Arun like answered within like minutes too, and told me to, calm down. Everything's gonna be okay. The patient's going to be fine. They're going to survive from this, and kind of walk me through kind of the best way to get the root out. And over the phone, sent him x-rays, texted them and whatnot. And sure enough, got the root out. Patient was fine. Everything was fine. So whether it's been Dr. Arun or not, I've always felt like I've had someone that I can reach out to, which is the beauty of the Aspen network of doctors too. So we have Dr. Arun. Dr. Arun mentioned that he has 13 doctors. So a lot of them are actually older doctors than I am, more experienced than I am. So sometimes I reach out to them if I can't get a hold of Dr. Arun personally. We have an oral surgeon that I can call who answers pretty regularly as well. We have a root canal specialist. Dr. Sleem answers regularly too. So there's always someone to kind of help if you are stuck in a tough spot.
Awesome. Dr. Arun, anything to add there?
Well, there were moments after she took over the practice in the first few months where she was, trying to run the practice when I was not there, that she felt a little bit more stressed, and I'm sure Justine remembers that. And those were days where all I would say to her was, breathe, take it slow, do one patient at a time, focus on one patient at a time. Don't look at the schedule and get scared for what's coming in the afternoon. Just remember who's there in front of you. Not the future is not important. The past is not important. The present right in front of you is important. Focus on that. And then she did that, and she started to believe in herself and found the confidence in handling it. And now she is really a rock star. So that's what we do for our doctors, to truly show them what to do and how to handle scenarios and how to face their anxiety.
Yeah, the toughest part for me too in the beginning was treatment planning, which I think is still sometimes the most difficult part of dentistry, because there's usually like, I don't know, 4 or 5 ways a tooth can go or a treatment plan can go, depending on what the patient still has. And, with y'all in dental school, whether your first year, second, third, fourth year, you're going to see a lot of different types of mouths that you're not used to seeing. We grew up maybe in a more privileged, healthier home, that a lot of us do have healthy teeth and healthy gums, and we see what that's like. And you're going to see a lot of people that don't have that. And it's kind of like, what do I do? And which teeth can we save? And what's most important for the patient? And how do we get this patient out of pain and get them back to healthy? And sometimes those kinds of moments were the most overwhelming for me. And that's what was so reassuring, that Dr. Arun has seen probably every type of mouth on the planet and knows how to navigate through different treatment plans. And, again, what's most important for the patient, what's going to be the best thing for them down the road too. So that was really nice and refreshing to have someone to bounce ideas off of, because the way that you learn dentistry may be different than someone else. And just having someone much more experienced than myself was very helpful, especially with those big treatment plans.
Yeah. Dr. Arun, not just for Dr. Bednarski, but what is your advice to all young new dentists that might be struggling with a treatment plan in their decision making? Is there any like special words of wisdom you have for young dentists?
First of all, be a good listener. Listen to the patient. Understand what they. Be a good listener.
I'm just kidding.
And understand what the patient wants, because that's what's going to dictate what direction you're going to go to. And if the patient says very clearly what they want, then that the solution sitting right in front of you from their words. But sometimes patients don't say exactly what they want. They're wishy-washy, they don't understand. Their level of understanding of dentistry is so poor that we need to have a flow chart. And then this is something that I teach my doctors. Start with where they are and go down the flow chart as to yes or no questions. Would you want this? Would you want that? Would you want this? Would you want that? And once you wean those questions down, you automatically filter down to the final foundation as to what the treatment plan is going to be. And so that technique or that way of really asking the right question to the patient and getting to know their answers will make sure that the treatment plan that you're giving is the right plan for the patient.
Fantastic. Okay. Let me just take a moment to, welcome everybody. There's a few that joined late. We have Dr. Arun Srinivasan, I hope I said that correctly, and Dr. Justine Bednarski from Aspen Dental. If you stay on towards the end, we'll be doing a raffle as well. We'll be raffling off a $75 Amazon gift card and a $25 Amazon gift card. So 2 lucky winners tonight. All right. So Dr. Bednarski, so you had mentioned that you moved to a lead dentist. About how long did that take for you to get promoted from Dr. Arun? And did you feel ready? And, was your days that were struggling any different when you were a lead dentist as opposed to an associate?
Yeah, so when I started as an associate, I was floating between a couple different locations of Dr. Arun. So Dr. Arun has 9 practices, all in Southern Mass. And when I was hired, I was, told I was going to be floating between 2 and that my schedule may be changing. And, I was really flexible. I was really wanting to just work and get experience. So I was okay with that. But there were a couple days that I would be covering doctors that were on vacation too. So I was kind of like the float associate at that point. And due to not really being in one stable location, I was really itching to be in that more managing role where I could have a more work home and a more dental home, I would say. I didn't feel like I was growing as much as just an associate. I actually wanted more responsibility and to see more of my own patients, make my own treatment plans, because as an associate, I was doing a lot of, general dentistry. I had 1 column of patients and procedures, times I got to dictate for those. But I just wasn't seeing as much consistency as I was hoping to. So as soon as a managing role opened up, Dr. Arun reached out to me and asked me if I was willing to take on more responsibility, which at that point I was. So this was November. I started in July, so it's 4 months down the road. Then I started full-time with Dr. Arun in December, and Dr. Arun was with me about 4 days a week, 3 to 4 days a week, I would say. Just kind of showing me how to manage a heavier schedule. So instead of having just 1 column of patients, I was managing the whole office, which is a procedure chair, a new patient chair, and then also an overflow chair. So upwards of, I don't know, if you have a full day, it could be like 30, 40 patients, which sounds alarming, but it's not like we're doing that many procedures or anything like that. So new patient exam, they will get, full mouth of x-rays. We do an iTero scan of their mouth. Our hygienist comes in, perio charts. I'll come in, do an exam, make a treatment plan. And if we have time to do any treatment that day, we will. Sometimes we do, sometimes we don't. And then we kind of go from there. Procedures are anything from extractions, fillings, crowns, implants, root canals if you're doing them, things like that. And then the overflow is a lot of more so denture appointments. So Aspen is very heavy with making dentures because we have lab techs that work in every single Aspen dental office across the country. So we are doing more dentures than the average general dentist does. And so in your overflow chair, you're going to be seeing post-ops, denture steps, any like quick appointments, things like that. So yeah, it was daunting in the beginning, seeing that many patients, and I felt comfortable having Dr. Arun. Then the days that I was there by myself, again, it would get a little bit overwhelming, but I would kind of extend procedures a little bit, give myself a little bit more wiggle room to kind of manage the flow of when to kind of pop out of certain rooms or when to do these appointments quicker and when to kind of bounce around. So I would say it became second nature like a couple months in. And then, yeah, I got officially promoted in May when I was basically by myself full time. Dr. Ian still comes to my office, I would say at least once a month, maybe twice a month when I want to do bigger procedures. I took an implant course with him last summer, and we still are transplanting implants, but I don't feel quite comfortable doing them by myself yet. So Dr. Ian will still be in the office with me when I want to do those bigger procedures to still kind of help me out and help me grow my clinical skills there. And
Awesome.
that totally answers your question. But.
Yeah, no, absolutely. That's great.
Jeff, we have a
Dr.
couple
Root,
of questions in the Q&A. If we can get to them as well.
Oh, hold on a second. Yeah, there's not too many in here. Hold on.
If you want, I can read them.
Oh, here we go. Okay, the first question, Dr. Arun, is in and around ownership, and they want to know, what that process looks like, and what are some of the trade-offs that you have to make owning an Aspen Dental, I guess, as opposed to owning a private practice, and do you have, control of what supplies, materials, equipments are in the office?
So as far as becoming an owner, if you're an existing clinical director and you're successful as a clinical director, then the option, you understand the business really well already as a clinical director. And so you will be approached, or you will approach. In my case, I approached myself when the practice ownership program started. And I think the program started that particular year. So I was one of the very first owners of the company. I think I would probably be about fifth or the sixth person who became an owner in 2007. And so I approach them, and then they come in, they see how you do, and if you're confident and there's already a successful, profitable scenario with you as a clinical director, then they talk about the terms of contract, and you sign the contract to become an owner, which is pretty straightforward, and it's not that much of a deal to become an owner. Obviously, you pay money to buy the practice, and then you own the practice. As far as your second part of the question for autonomy as to what we want to get as materials, supplies, decisions for lab, all of those are completely up to the doctor, whether it's the owner. In my case, I don't even bother what Justine wants to buy for supplies. So it's her choice. The MCDs, the clinical directors, pretty much choose what they want to have for supply. If they have a specific preference, specific instrument, or an equipment that they need, they have the full reign and freedom to get what they want. That makes their dentistry better. As far as the trade-off as being an owner, I truly don't see any trade-off as a negative being an owner with Aspen. The trade-on to go on the to go on the positive side is that I truly work 8 to 5, but if I say 8 to 5, Justine will probably laugh. So I work 10 to 3, maybe 10 to 4. So that's my hours. And if I have to cover for, say, Justine's on a vacation and I need to go cover for the office, then I'll probably work the whole day. But otherwise, I have the flexibility of hours that I want. And, I don't go home and do, payroll or marketing or, pay bills or collection, none of that stuff that other private practices have to do on their own. As a dentist, I don't have to do that. I have the background people who are really professional and extremely skilled in doing those jobs and those functions very effectively to do that for me. So I go home and play with my kids and have my libation in the evening and have a good dinner. That's
Nice. That's great. Another question's rolling in. I mean, a few are actually now. Thank you, Armin. What they want to know about insurances, and do you in your practices, do insurances kind of dictate what your procedures that you can do? How does that work?
No, we pretty much take all insurances except for state or federal funded insurance like Medicare, Medicaid, or state funded insurances. But no, none of the insurance companies can actually dictate what you do as dentistry. What they provide as reimbursement, that might vary. And, but that doesn't make a change in what you do as dentistry for your patients. If I'm going to do this treatment plan for a patient with Delta Dental, it doesn't change because he changed into MetLife from Delta Dental. It doesn't work that way. So whatever is right for the patient is what we treatment plan, and that's what we deliver as a treatment. Yeah.
And Dr. Bednarski, do you ever find yourself, kind of changing treatment plans based on insurances? I mean, I don't know if there's a right or wrong answer about that, but is there any times that you feel like you're pressured from insurance?
No, I don't. I felt like when I was first out of school, I was definitely treatment planning more fillings and things like that, because that's what I was used to doing when I was in dental school. We would do, these massive amalgams and random, like, not really long lasting dentistry, I would say, just because that's what, we could do in dental school and what the state funded insurance would cover, which most of our dental school patients had. But no, I just think about what's going to be best for the patient and best for the tooth at the end of the day. I don't ever talk about money and not in the operatory. Patients will ask me how much it's going to cost, and I just deflect the question and I say, you're going to chat with my office manager after me. She's going to go through cost everything. If you have insurance, she's going to go through that. And if you don't, she's going to see how we can make it affordable for you. Sometimes we can offer like a discount to our patients if they're self-pay, and that's kind of decided by the office manager. I don't really have much say in that, but I can if I want to. But if it's still, surgical extraction, it's surgical extraction. Like, what else can I do? But with that, we do work with a couple like third-party lenders that the patient can apply for financing, so they can use that and then, pay that off over time and whatnot. So there are other options, but I've never felt pressured or felt like I shouldn't be treatment planning because a patient has a certain insurance or not.
Okay. This one's about continuing education. What sort of opportunities do you all have as dentists for CEs or even fresh grads?
Justine, would you like to take that?
Sure. So I actually am taking a CE course next weekend because I got advised to do so, to put it politely. But no, there are a lot of different online CEs with Aspen. They've been doing a lot of these Zoom webinars lately too. So a big push with Aspen when I first joined, they had just acquired representative with Invisalign, and they were getting, pretty much every office was getting an iTero scanner. So we all got trained with Invisalign. And so that was one CE that was provided through Aspen Dental, even if I had gotten one through my dental school, but I got certified again with that. Right now they're rolling out some implant CE. So there was a lot of online textbook reading, things like that, that was CE offered through Aspen during COVID, when we were all like pretty much off. And now they're doing a live webinar next weekend. Actually, it's going to be Friday afternoon and Saturday all day. So that's going to be through Zoom as well. And then I think they are going to do a hands-on course sometime maybe next year. I don't know, whenever COVID restrictions lift, but that's been in the works too. Other than that, there is a lot of different online stuff. There was a 1-week EDGE program, which is energizing dentists, gaining excellence, growing excellence, gaining excellence. But that was a week-long course where I got to go to Chicago to the headquarters, learned a little bit more about what Aspen Dental has to offer, what ADMI has to offer. And we learned a little bit more about dentures and the different types of dentures there, learned some leadership skills, things like that. So that was a week-long course that was also offered through Aspen that was all for free for me.
Have you ever had to pay out of your own pocket because you wanted to take something that wasn't offered?
Not through like Aspen directly. I mean, if I want to do my own CE, I could, like Yankee Dental is here in Boston. And if I want to take any CE courses here, then that would be out of my own pocket. Right. But otherwise, no, nothing that Aspen's like made me pay for or anything like that.
Okay. I just want to make a comment too, that aspendentalce.com is our Aspen Dental Learning portal. And actually that is open to all dental professionals, students, residents, all dental professionals, at least till the end of the year, free of cost. So if you will go on aspendentalce.com, I put it in the chat button here. You can go in and create an account and take take online courses for free, all of you in attendance tonight. So just a note on that. Dr. Arun, anything to add on CE, overall?
Justine was pretty spot on as to what they provided from Aspen per se. They go through initiatives in different parts of dentistry. Invisalign was a big thing 2 years ago, and then implants a big thing right now. But we, as myself and my team, we have individual study clubs that we conduct once in a couple of months. Obviously, COVID has thrown a monkey wrench in it, and I couldn't get all my dentists in a close place and conduct a study club, which is after COVID. But it typically otherwise we would do that. We would pick topics and we will rotate doctors to actually present the lecture, present cases, clinical cases. And then I took my doctors, and Justine kind of hinted about that in the previous answer. I took my doctors. I've taken my doctors twice so far to Dominican to actually go and place implants on live patients. And Justine placed about 20 implants, and so did all of my doctors in 2 days. And so that's something that I do personally for my doctors. It's my personal initiative. That's not related to Aspen, but that's something that I do. I have a passion for surgery and implants, and so I want my doctors to be comfortable to do it. And if not comfortable to do it, at least be comfortable to treatment plan it, so I can go show them and develop that skill for them. And so that is something that we did as well for my doctors.
You bring up a good point, Dr. Arun, that, when you join Aspen Dental, for the most part, you work directly for a dentist that owns the office. So, and that's a good segue, because there was a question about compensation. And I just think it's a good segue because that wasn't something that Aspen Dental subsidized. That's something that Dr. Arun, as the owner dentist of, and CEO of his group practice, took upon himself to provide to his dentists. So a question that has been up here twice so far is, they want to hear about how dentists are compensated. Dr. Arun, are you comfortable talking about the philosophy behind the compensation and how your dentists are compensated?
Sure. So the compensation structure is a little different than how private practices compensate dentists. Typically, dentists get paid on their production or collection of whatever they do as dentistry. So the day you don't do and provide patient care, you don't make money. Whereas in our practices, we have an oral surgeon in every practice who comes to the practice once a month. We have an endodontist who comes once a month. We have hygienists who do hygiene treatments for us, and doctors don't provide hygiene treatments. And we have an MCD who is a clinical director and an associate doctor. So there are 5 different providers for each practice. Each one of them generates the revenue, and the revenue that's coming together as a practice revenue is what is based for your compensation. So as a clinical director, it's his responsibility not only to do dentistry, but also to provide enough dental treatment in these providers, their appointment book. So when they come in, they are productive. If they are productive, the office is going to be productive, and we all get a piece of the big pie. It's not based on what you do. So you don't have to break your back and work 8 hours a day and nonstop crown preps after crown preps. Well, although you can make money that way too, but if you can make your associate busy, your associate's revenue is going to be part of your revenue. If you can make your oral surgeon busy, the oral surgeon's revenue is going to be part of your revenue. And so it's a mentality where we win together. It's a mentality where patient wins and we win. And as long as the patient gets the treatment to be accepted and we get them to start treatment and we provide care for them, it doesn't matter who does the dentistry. We make money out of it, and every single doctor who is a part of the team gets compensated of it. Obviously, the clinical director, who's a managing person who is in charge of the practice, has a higher pay. So we give them 16 to 20% of the gross profit. I don't want to get too deep into how this gross profit is calculated. It's kind of, a whack if I'll spend about an hour going over the P&L with you. But the basic idea is that we take the total revenue of the practice, we take some controllable expenses out of that, and the remaining dollar value is your gross profit. And the clinical director makes 16 to 20% of that. And the associate pretty much gets half of that, which is 8 to 10%. So the more responsibility, the more you manage everybody's schedule, the more you manage patient care, the more you get the patients to say yes for treatment and continue treatment or start treatment, the revenue is going to fall in and automatically generate a good reimbursement or compensation for the doctors at the end of the month. If I have to give you a dollar value, if a practice does $200,000 a month consistently for a 12-month period, the dentist who is a clinical director makes somewhere between $300,000 and $350,000, $300,000 to $350,000 as a clinical director. So if you think about it, you can cut that by half. If you're an associate, you'll probably be making about 150 to 170, 180 as an associate. So that's the ballpark. Obviously, if the practice is not doing 200, if it's doing less than that, the 130 and 140, the pay is going to go down. So it's not a definitive pay based on, your position. It's about how the office performs. So it makes the dentist really think about the office's success as their success. And so they're motivated. They're not only doing dentistry, they're more concerned about what the patient needs and how to make sure every single provider is kept busy.
Doc, that was really well articulated and comprehensive. That was really good. I think you have a career in recruitment coming. I don't think I said it that well ever. Justine, do you have anything to add on that?
Yeah, so one big thing that was enticing for me to join Aspen out of any other corporate or any other private practice was the fact that there was a guaranteed daily rate that never, ever, 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 ever goes away. So that's a salary that I can depend on, and something that I like that is consistent. So my paychecks are consistent, whether I have a really successful month or I have a not so much successful month, I still have my base salary that I can rely on. Now from there, depending on how busy we are, how productive we are, what Dr. Arun alluded to, depends on how much production you have per month. My incentive bonus can be really great, or it may not be. So every month is kind of different, but that is something that's addition to my base salary. Now that range that Dr. Arun talked about, that 16 to 20% or 8 to 10%, the difference there of what your percentage is based off of your patient satisfaction scores. A patient satisfaction score is basically an anonymous survey that your patients, they get an email that says like, oh, if you'd like to rate your experience with Aspen Dental, like would love your feedback. And it's anonymous. People will give you a rank based off of the experience they had in the office. So that's an incentive for yourself to be, kind, courteous, manage your team, make sure everyone is, on the same page, being pleasant in the office, because that can be a difference of upwards of $1,000 or more a month that could be in your pocket just based off of the way the patient felt from their experience. So that's kind of part of.
Yeah,
thank you. Thank you.
Organization-wide, that's something we're pretty proud of, is building patient satisfaction into the clinical pay. Dr. Lewis, do you have something to add there?
Yeah, I just want to say thank you to Justine for bringing that portion of the patient satisfaction survey piece. As an owner, for me, it makes me feel like I don't need to be in every single practice every day, because my doctors take that ownership on themselves. And so patient care is their priority, and dealing with this patient and giving them the right treatment and treating them the best way is a part of our biggest priority in our offices, because that ultimately converts into your compensation. That 16 to 20%, if you imagine 20% is supposed to be $350,000, then 4% of that 350 is a lot of money that you will lose if you're not being nice to the patient. And so the doctors get that very quickly. Although we speak about it from day one, we try to make sure all the doctors understand that. But when it comes into compensation, it really reflects it. It kind of gives you a higher motivation to be nice to your patients.
That's awesome. So there was a follow-up question to that, and it's really perfect because you just talked about compensation and how associates are compensated different from clinical directors and obviously owners. Dr. Arun, you want to take a minute or two to talk about an associate and what the lead dentist / MCD is, and kind of define that acronym, and then talk the difference about as ownership as well. Just a couple minutes on that to clarify, please.
Okay. So MCD stands for Managing Clinical Director, and the title pretty much says what we expect out of the doctor. He's the director of the practice, and he manages the practice. So when we say management, he's going to take care of the dental assistants, how they are trained. He's going to make sure his receptionists are the front desk PSR, we call patient service representative, is having the right phone etiquette, and they are treating the patients right, greeting the patients right, and the office manager is giving all the options possible for the patient to make sure that it's affordable for the patient. So all of this is the managing part of the clinical director, and as a clinical director, they pretty much do all the treatment planning for new patients and periodics. And so when they do the treatment planning, they decide what is right for this patient, and they take the responsibility. So pretty much the entire practice, revolves around the clinical director, and hence a higher compensation. The associate, like a fresh grad, like Justine was in the beginning, when they come in, they are focused on doing dentistry, getting comfortable, getting to know the equipment, getting to know the staff, getting to know the flow. They are not really given the responsibility of managing the practice, nor performing the practice treatment planning and executing the dentistry as well. All they are responsible for is their one column of procedures, whether it's a filling or an extraction or a crown prep, and they are given plenty of time for them to accomplish the task as in what they need. And so there's a big difference in what they take upon between associate and a clinical director. Clinical director is in charge of the whole building and everybody in it, and the associate is one of the people who the clinical director is in charge of. So there you go. And then ownership piece. As an owner, my job is to become a mentor to my doctors who come in as associates, who want to be clinical directors. And my job is also to make sure the quality of care is there. My job is also to be the leader, motivator, and show them the right direction in which they could go to see the fruits of their labor and make them more efficient and more successful as a dentist. And that's my role.
Hey, Dr. Bednarski, anything to add there? Associate versus MCD?
Yes. So when I was an associate, especially because I was so new, I kind of was working with the MCD and with their treatment plans, which I was okay with. I mean, I trusted the doctors I was working with. If I ever had something that was maybe a little bit different than what they had to say, as far as like a filling or a crown, or didn't agree with something, I would just ask them, what they saw in this X-ray, what they saw in this tooth that maybe I didn't agree with. Most of the time I did, though. But once I became an MCD was when I started, making my own treatment plans, and then also completing my own treatment plans. There were a couple of times that I had that opportunity as an associate if I saw a new patient, more so later when I was not fresh associate, when I had been being an associate for a little bit of time. I would see a new patient, and then the MCD would let me, follow through with that patient. Again, I was in a slightly different situation than most people are, where I was floating around a lot. So I was kind of working on other people's treatment plans. But as an MCD, again, I treatment plan all the dentistry. I do all the dentistry. I've learned from my treatment plans that some things are not as successful as others sometimes. But that's part of learning and growing and developing your skills. So it's a couple number 18s with the big distal caries that I would treatment plan for root canals, and then I would do the crown prep and realize that this was not the greatest of ideas. So again, you kind of learn from your mistakes, but you also just learn from your experience too, and you learn what was successful and what you do enjoy doing, and you do more of it and you get better at it too.
All right, there's another question coming in. I think Dr. Arun, you can hit on this one a little bit. It's what are the trade-offs of being a specialist with an Aspen Dental office as opposed to like a private office or a smaller group?
Okay, so the specialists that we have, two specialty that we have as providers in our practice. One is oral surgery, another is endodontics. And so the endodontist and oral surgeon, I think, have a phenomenal compensation and a lifestyle, because they don't have to pay for a brick and mortar place where they do their dentistry or they do their specialty. That belongs to me. They come to my practice, and their schedule is already booked. The patients are already treatment planned, and their requirements as to what they want and what their standard of care is already given to the doctors, the clinical directors. So their schedule is packed. They come and do dentistry and walk away, just like me coming to my practice, doing my dentistry and walking away, and not to think about my management side or the payroll, the collection, the insurances and all of that, they have a very similar lifestyle. They come in, do their part as a specialist and go home and collect the money in the bank. So, and they for sure make a lot more as a specialist in our offices than they would in a private practice setting. I don't want to get into exactly how much my oral surgeon makes, but it is somewhere, which is filthy amount of money that he makes. But he works his butt off for it, and so but he works hard and he works every single day, but he makes a lot of money.
Yeah. Yeah.
It doesn't hurt.
So I want to switch gears a little bit, Dr. Arun and Dr. Bednarski. Dr. Arun, you being a veteran, talk about the healthy mouth movement and some of the charitable sort of initiatives that we have going on at Aspen Dental.
There are a few different ways in which we try to give back to the society and serve our society. As in, when we say society, it's not just within the country of the United States. We also go abroad. We do have overseas outreach missions. Justine was supposed to go to Cambodia. It got canceled because of COVID. And I have been to 3 different missions so far. I've been to Peru, I've been to Honduras, and I went to Trinidad. The latest one last year was Trinidad. Those are all the 1-week missions that we go to, and we bring our equipment with us, and we treat patients for free for a whole week. We take about 3 or 4 hygienists, 3 or 4 doctors, and about 3 or 4 dental assistants with us, and we provide free care in these countries for those 1-week period. And then apart from that, within the country, we have something called a mouthmobile. That's a 42-foot, huge tractor trailer, which can expand into a larger size space, which has about 3 chairs, a panoramic X-ray and a PA, all digital. And we have all the equipment that you need for autoclave and sterilization. We have equipment for the lab. So it's pretty much a running practice on wheels, which travels all over the country. It starts from the Northeast to the Southwest, and it crisscrosses all over the country. And every time it makes a pit stop in your area as an owner or clinical director working in that area, you have the opportunity to go get on the bus and serve veterans on those days. And then I've been doing that for 8 years, ever since that whole movement started with the healthy mouth movement. And every year I at least get an opportunity to go in there once. And I think I took Justine with me last year when we went to Springfield. And it was a great experience. And it's a great experience every single time. Apart from that, we also have day of service where, because I'm a veteran, I have a soft spot from my uniform service members, my brothers. And so we open my practices one day a year for any veteran who needs care. They could come in and have free treatment that day, regardless of what it is. We sometimes even adopt veterans who come on that day. We end up treating the patient completely, start to finish, over the period of the next few months. And we do that as a pro bono work. We do the same thing with the healthy mouth movement as well. If there's a veteran who needs help and what we can do on that day in the bus is not sufficient, we feel like we want to really adopt this person and help that person, then we bring that patient back to our offices and treat them for free and make sure we give them a clean certificate of health.
Awesome. Dr. Bednarski, anything to add to the healthy mouth movement?
Not much. I think Arun kind of nailed it. I did go on the bus. It was 2 years ago, actually. I was working about like a month and a half and got to go with Dr. Arun. So that was a really, really cool experience. Something that I had not really seen. My dental school had one for pediatric patients, but yeah, I had never seen that for veterans or anything like that. So it was pretty cool. And yes, Arun did mention I was supposed to go to Cambodia in April. COVID changed my plans, not happy about it. But there was an opportunity to go on a trip, and every dentist within Aspen Nation, they, if you've been working for over a year, you can apply to go on these mission trips. So I'd applied and was graciously chosen to go. That trip in particular, they were actually going to do it as all women in dentistry, which was kind of cool. But unfortunately got canceled. So I don't know if it's ever going to happen again, but yeah, cool opportunity.
Yeah.
Oh, Justine was on the TV when we were on the Healthy Mouth Movement, right, Justine?
I was, yeah. I got on Boston News or Massachusetts News or whatever. It's funny. I sent the article to my dad, and it was one of the proudest moments. Made it on TV.
That's fantastic. Is that the picture you sent me?
No, not that one. I sent you one of me and Dr. Arun next to the Massmobile. No, there was a news article. There was me doing, I think, a filling on a patient.
Oh, right. No, I meant, is that the time that you?
Yeah.
Is that the time? Okay, yeah, that's what I meant.
Yeah.
That's awesome. So there's a question coming in, and you mentioned COVID and how that affected that trip, but it's affected a lot more than that. Dr. Arun, can you talk about how COVID has affected the organization at whole, and then just your offices as well?
So we had to close our offices for a good 2.5 month period because that was mandated by the government. And we opened up our practices when the Massachusetts state government allowed us to open. We kept doing emergencies in the beginning, and I did not open all 9 of my practices. We opened at least, I think, 3 in the beginning, and then we made it to 4. And we slowly added on other practices when we felt it was safe enough for us to bring all the dentists on board. And those first 3 practices which were open were also practices where the dentists chose to come and work. My clinical directors couldn't sit at home, and they didn't want to be at home. They wanted to be in the front lines and help people. And they kind of made me feel that this is their call for them to be in their offices helping patients. And I remember Justine was trying to call me, and she almost cried. I think she cried that and she asked me to open her practice, and I said, Justine, relax. I didn't open her practice, by the way. So I opened the other 3 practices other than hers, and that's why she cried. But then we ended up opening other practices, and she came to work as well. Awesome. As far as restrictions, we from the get-go, when we opened only for emergencies, we took every single precaution that we can to make sure it is done right and it is safe for the team members and the doctors and the patients. And so PPE were a big thing. So we were double masking, face shield, gowns. I mean, you name it. We were like almost like an astronaut suited up before we go see patients. And the cleaning protocol and sterilization protocol was almost beyond imagination. It was to the point where we were very, very anal about it. And so we did get through it. And we were lucky enough as a company, as an organization, to get into the PPP program funded by the government to give small business owners some kind of funding for us to get through the negative spot of the COVID, how it affected us financially. So even though we were not working, after a period of, I think, 2 weeks, maybe 3 weeks, how long did we not get paid, Justine? Do you remember? Maybe 3 weeks, I think.
I don't remember.
Yeah, so I think for about 3 weeks, in the beginning of COVID, none of us got paid. We were all sitting at home doing nothing and not making money. But then the PPP program was approved. We got the funding from the government. And so we paid all of our doctors and the team members to do CE courses at home, use the online resources, the aspendentalce.com, and keep themselves engaged and occupied, and at the same time not worry about money as a scenario that's going to make them feel even down than what it was. We were all emotionally disturbed with COVID and how things were happening around us. At least the financial part, the PPP loan, kind of helped us out. And we are at the second month. We actually started doing full dentistry in the month of June. June 8th is when Massachusetts state government allowed us to do dentistry apart from cosmetic work. And so from the month of June, for the 3-week period, we did about 80% of our typical revenue otherwise before pre-COVID. And then in the month of July, we actually did 110% of the prior year's revenue. So we were back to full flow, absolutely, jammed. And you could see the patients were waiting to have treatment done. They couldn't stop coming. And we've been busy. COVID hit us a little bit, but we got up, stood up, and we are marching along.
Two questions just came in while you were chatting, Doc, and that was a really good comprehensive answer on COVID and how affected. Two questions came in. Did the PPP go through Aspen or practice by practice?
It's by owner. So Aspen will not be eligible for the PPP program because they have more than 12,000 employees. This is only for small businesses which have less than 500 employees. Small business by itself has a definition of something which has less than 500 employees. So I have 9 practices. Amongst the 9 practices, I have about 110 people who are employed by me. So I kind of fit the bill as a small business owner. So we applied for that and we got approved for the loan. And we are in the process right now of filing the paperwork for forgiveness. And so, yeah, that's exactly what happened. It's not.
Yeah, and it goes back to a question they asked earlier about the pros and cons of ownership of Aspen Dental. And let me just comment and say that, look, if we didn't have the practice ownership, we wouldn't have been eligible. So Dr. Arun was eligible for that because he's a practice owner, something that not very many DSOs can say, that actually the doctors purchase the practices, own and operate the practices, and that's why they're eligible. And you mentioned that. I just thought it was worth reiterating. And then the questions for you, Doug, too, Dr. Arun. Do you ever feel overwhelmed working every day? And what do you do with your free time?
Oh. Well, in the beginning, when I started my, my career with Aspen in the beginning in 2006, 2007, almost till 2000, let's say 14, 15, I was establishing these practices and growing consistently by adding one practice or other. And I had my Army Reserve responsibilities. I was a company commander for about 3 years. I had to babysit 120 soldiers from age 18 to 40. And so I had a lot of things going on in my life at every point. But once I hit to 2015, 2016, the gears kind of slowed down for me. I had really successful, strong clinical directors, young doctors who were really doing very well without my help. And so my role kind of became less, to be honest. Right now, I just, I go and visit Justine, buy her lunch, and ask her how she's doing. And if she has an implant or two to place, I would make her place it. I don't even place the implant because it's for her to learn, and it's for me to be there for moral support. I'm not there to do dentistry or show or do the implant placement. I'm just there to say, Justine, this is the next equipment here. This is the next instrument. Go to drill depth of 10 millimeters and stop. And so
you assist her then, huh?
It's true. And so that's what I do right now. But I didn't come here on day one. I didn't start here. I had to work hard and grind and did all that I had to do to come to this place where I am right now. As far as my free time, I typically, I have a swimming pool in the backyard. I have my daughters. We get in the pool. We, do some laps, play cards with my kids, watch TV. I'm a simple guy. I don't have, big hobbies that are expensive or time consuming.
How about you, Dr. Bednarski? What do you do with your free time over there in Boston? I saw you in bed. That's pretty hot.
So I just moved to downtown Boston this summer. So I was living a little bit on the outskirts of the city. So now that I'm downtown, I do have a little bit less free time during the week because I'm commuting to work. But my weekends, I don't know, I like to be out and about in the city. I don't really like staying at home often. So usually we'll get together with friends, go grab dinner and whatnot. Before COVID, I was in the midst of becoming a yoga instructor on the side. So that was something that I was supposed to do in March and into April. And I was going to be doing that like 1 to 2 days a week after work, of course. But that just didn't really pan out anymore. I still practice in my free time, but it's just not the same. I'm not being in a studio currently. Nice. Aside from that, I was helping with recruiting too. So that was kind of fun. I was working with Jeff a lot and some of the other academic directors across the country, going to ASDA events, going to Aspen events, just kind of telling my story and, trying to help young dental students kind of navigate the best thing for them after dental school life. I know it's hard. It's hard to decide what's gonna be the best thing for you. So I feel like my story can kind of help show people that even if your original plan doesn't work out like you think it's going to, life's still going to turn out pretty well and things will happen the way they're supposed to. So.
Nice. Well, we're over our time, believe it or not. And most of the attendees are still on, so that's fantastic. So that means you all did a great job. I want to just thank you both, Dr. Arun and Dr. Bednarski, for spending time with us tonight. I want to thank Armin and Becca for helping put this together, and the rest of the Dental Economics Club. Armin, do you have any words of wisdom?
No, thank you so much, Dr. Arun, Dr. Bednarski. It was a pleasure, and I'm sure everyone enjoyed all the honest answers that you have for everyone. Thank you for that.
Dr. Arun, any last thoughts to the guests?
Well, finish school. There's always a career. There's so much more in the real world. And so, when you come outside, the only thing I would say that I said in the beginning as to what I expect from my associate doctors, be motivated, be energetic, keep an open mind to learn, and just remember there's always somebody that's there to help you in the real world, at least within our organization. Just like Justine said in the beginning, if I'm not available, there are 4 or 5 of our senior and clinical directors who are all more than happy to help them out and, groom them and develop them. So, yeah, I wish them all good luck and, get through this COVID and get your 4 years of dental school in, and then come and see us and we'll take care of you. And obviously based on our needs and requirement, but there's always going to be some requirement somewhere.
Thank you, Dr. Arun.
Thank
Dr.
you.
Bednarski, any last thoughts?
Not really. Really thankful that you guys set this up. I know Zoom calls are probably getting old, but hopefully we offered a little bit of wisdom. So best of luck to everyone in dental school. I hope COVID isn't going to put you guys too far behind or stress you out too much more. But there is still light at the end of the tunnel. And like Dr. Arun said, there's always opportunity. Aspen's always hiring as well. If y'all have any other questions or want to reach out, I'm available. I'm sure Dr. Arun's available through email. You can find me on social media too, any platforms. I'm an open book, happy to share any other piece of advice that I can. So just reach out if you need me.
Awesome. And my final words will be thank you. And we have 2 winners of the gift cards. Let's go with second place. And I may get this name correctly and I may not. Purandai Shivara, the $25 gift card goes to you. I hope your email is correct. I'm going to send it to your email. If not, send me a quick email. And first place goes to Miriam Berlin. So that's a $75 Amazon gift card to you. So congratulations to the winners. Thanks again to the Dental Economics Club at NYU. Thank you, Armin, for helping us out. And that concludes our broadcast for tonight, ladies and gentlemen. Have a wonderful night. Thanks, everyone.
Thanks, everyone.
Thank you.
Bye.
Thank you.
Bye-bye.
Thank you.